I recently went to the Lax Cancer Center in Grand Rapids, Michigan and interviewed 2 breast cancer specialists. They were uncomfortable with me posting a video of our interview, so here is my report. Healthcare providers believe it is important for women to start screening at the age of 40, despite the differing views of insurance providers. The American Cancer Society recommends that all women get mammograms starting at the age of 40, but young women should begin monthly self-breast exams when they are teenagers. This is primarily so that women can get to know the feel of their own breasts, making them more likely to notice abnormalities in their tissue, which they can bring to the attention of their healthcare provider. For women who have a first-degree relative, such as a mother, with breast cancer, it is recommended that they start screening 10 years prior to when said relative was diagnosed. If secondary relatives, such as an aunt, are diagnosed with breast cancer, the risk factor of getting breast cancer for others in that family is statistically not significantly higher than the general public's risk. However, it is a little bit higher. If more than one person in a family has breast cancer, there seems to be a pattern, and genetic testing is done to see if it is something that is hereditary. Perhaps someone in that family carries the BRCA1 or BRCA2 gene mutation, which makes the risk higher and the chance for them to develop a second breast cancer also higher. There is also a risk of ovarian cancer associated with this mutation. The ovaries, then, will usually be removed when the woman is between the ages of 35 and 40. But if they are going through breast cancer surgery and treatment, it could be a year before they are removed. The 2 biggest risk factors for developing breast cancer are being female and getting older. 1 in 8 women will develop breast cancer, and it is likely that they will develop it after the age of 60. The older you get, the greater the chances that you will develop breast cancer. Some of the risk factors that we can control include not smoking, moderate alcohol consumption, exercising, a healthy diet, and maintaining a healthy body weight. All cancers are staged. Breast cancer has stages 0, 1, 2, 3, and 4. Stage 0 is a cancer that is still encapsulated within the duct of the lobule. This is considered stage 0 because the cancer is still enclosed within its little membrane. All stages are based on the TNM criteria. T is tumor size, N is the presence or absence of lymph node involvement, and M is whether or not the cancer has metastasized and left the breast. The different stages are based not only on the size of the tumor, but how many lymph nodes are involved, if any. There is a chart that the physicians use to determine the stage once the tumor has been taken out. A tumor that is 1 centimeter in size, has no lymph nodes involved, and hasn't metastasized is considered stage 1. A tumor that is 3 centimeters in size, involves 1 lymph node, and hasn't metastasized is stage 2. Whenever possible, the cancer is removed, because if left, it can move outside the breast. After the cancer is removed, women may need additional treatments, but these will vary. Some women just need the surgery, others need surgery and radiation, others need surgery and chemotherapy, and still others need the surgery, chemo, and radiation. Radiation therapy is given once a day, 5 days a week, Monday through Friday, for about 6 weeks, and chemotherapy is usually given about once every 3 weeks for 4 to 6 cycles, depending on the circumstances. A lumpectomy is where they remove the cancer and a rim of healthy tissue around it. They do this so that they not only get the cancer but also all the tissue surrounding it to make sure that the breast is now cancer-free, which is always the ultimate goal. A mastectomy is where they remove the entire breast. After a lumpectomy, there is radiation treatment to treat the rest of the tissue just in case there is a single cancer cell out there somewhere. With a mastectomy, all the breast tissue is removed, which means women may not need radiation therapy. It depends on how big the tumor was, how close it was to the skin, and whether or not they had lymph nodes involved. There are a few chemotherapy drugs that are given in pill form, but not very many. There is, however, an anti-hormonal treatment for those sensitive to the female hormones. It is recommended that they take a pill a day for 5 years after all the treatment is done. The pill prevents the estrogen from getting into the cancer cell and feeding it, so it basically starves the cell, which significantly reduces the risk of future cancer. Every woman who has to go through chemotherapy will lose her hair, but those going through radiation therapy will not. Chemotherapy gets in your blood system and attacks all rapidly reproducing cells. It cannot differentiate between healthy cells that reproduce rapidly and cancer cells that reproduce rapidly. After chemo, when the hair does grow back, it is usually fuzzy or curly and sometimes a different color. During chemo, the hair is actually growing all the time, but it doesn't get to grow long enough between chemo treatments for you to notice it. In addition to attacking the hair cells, chemotherapy will also attack red blood cells, white blood cells, platelets, and the cells that align the GI tract. Some side effects of these drugs can include nausea, vomiting, diarrhea, and hair loss. There are really good medications out there to prevent the nausea and vomiting, but none yet to prevent the hair loss. There are all kinds of clinical trials out there, and there are currently 11 trials being offered at St. Mary's. Not everyone is a candidate because the criteria are really strict, but they screen everybody with every type of cancer, and if they appear to be a good candidate, they offer the trial to them as an option. Things are constantly changing. Even some of the drugs that have been used forever and ever might be used differently or in combination with something else. They are constantly looking at developing new drugs and using tried and true ones in different combinations or at different timing schedules. The earlier the cancer is found, the better the chance there is for a cure. Annual imaging and having annual breast exams will help catch the cancer early. It is important to be diligent and pay attention to your own body. If you suspect something is wrong, you need to pursue it. Women can get breast cancer as early as their 20s and as late as their 90s. Healthcare providers will not operate if there are health issues that will complicate the procedure, but they always try to operate and remove all of the cancer. However, if they cannot operate, they still try to treat them. If the cancer is estrogen sensitive, they will give them pills which will sometimes shrink the tumor and make living more comfortable. The first appointment women have after surgery, which is usually 2 to 3 weeks after the surgery, is just a post-op appointment to make sure that their wounds are healing well and to get them to all their other doctors, the medical oncologist who will talk to them about chemotherapy, and or the radiation oncologist who will talk to them about radiation therapy. After they are done with those other phases of treatment, usually about 4 to 6 months later, they will come back for at least once a year for 5 years. At that appointment, they get a breast exam to make sure there is no evidence of recurrence of cancer or cancer on the other side. They also talk about how they are tolerating the preventative medicine they may be on. Make sure to get their breast imaging, mammogram, and sometimes even a breast MRI set up for the next year. Watched very closely for at least 5 years after their surgery to make sure that the cancer does not come back or develop somewhere else. Those who have a mastectomy have to meet with a plastic surgeon to learn more about the reconstructive process. Some women choose to have reconstructive surgery while others do not. It is a joint surgery, so the day they have their surgery, the plastic surgeon is there as well, and they start the initial phase of reconstruction. The patient doesn't wake up with a fully reconstructed breast, but at least they wake up with something and they are beginning the process instead of waiting 6 months to a year to start the reconstruction. Women have a choice as far as the type of reconstruction they want. There are 2 choices, an implant-based reconstruction and one using their own muscle or tissue, which could possibly come from the lower abdomen or back. Most women go with the implant option. Women will wake up with a tissue expander, which holds the place of where their final reconstruction will be. There is an option for a nipple reconstruction and nipple tattooing at the end of the reconstructive process. Some women do not do any reconstruction of the nipple, while others have a nipple-sparing procedure where the nipple may be saved and can be used. There are no guarantees. The care is very individualized. It is never cut and dry.